Hi everyone. I wanted to give you a quick update. I have chemo tomorrow. So tomorrow is chemo number 12 of the once a week paclitaxel and carboplatin. It is the last one of that chemo. And then I have a week off, and then we start on November 14th with the adriamycin and Cytoxan, which is supposed to be the stronger kind of drugs to kind of finish it off. And that is every other week for 8 weeks, which is 4 treatments, and then I will be done with chemo. Side effects, as I've been kind of updating you, the most prominent side effect is probably the constipation, and then finding the right amount of laxative or stool softener to not have constipation without having diarrhea. So I think that I never really caught up last week when I kind of took that day off for the college visit. And so this week has been another one of kind of, constipation for a couple of days and then diarrhea for a couple of days. So it's, other than that though, I don't have nausea. I haven't lost my appetite. I think that, there's my dog. Hi, Addie. I think that, relatively speaking, I feel pretty good. I don't have a ton of energy. As the weeks go on, I am getting more and more kind of periods of just extreme fatigue. But I'm just tired. I'm just okay, I just need to prioritize and decide what I need to do. So that's kind of my side effect update. My good news update is I had the follow-up with the surgeon. So when I started this journey, once we had confirmed the biopsy came back positive, my first oncologist that I met with was the surgical oncologist. And I had my follow-up with her this past week. And that is, that was the plan. We would follow up with her about halfway through the total time period of chemo, which is 20 weeks total. And it was week 11. So I met with her and she did her exam and she actually could not find the tumor. And I've noticed that it has been shrinking. And so in her palpation, she could not find the tumor. And she actually took me next door and did an ultrasound, and she found the biopsy clip, but did not see the mass that was there at the beginning of this. So the chemo is working. The plan has not changed. The chemo will continue, and then I will have surgery about a month after I'm done. And then after that, there will be radiation. She said that, and so we talked a little bit about all this. So the reason that we're continuing chemo, even though she can't see the tumor, is because it's probably not gone, but that was the goal, right? That was the goal, is to eliminate the tumors in the lymph nodes and to shrink the tumor in the tumors, and there were 2 tumors in the breasts. And then the surgery will still happen because they will take out all of the tissue surrounding the biopsy clip, the marker that they put there, and then do radiation, very targeted radiation on the area so that it would squelch any chance of regrowth. And that allows them, again, to use the word cure. The goal is complete response, cure the cancer so that it never comes back and I never need to worry about it again. And, I talked a little bit in my first video about how it's really hard for me to trust doctors, and maybe if I didn't have kids, I would be going a more natural route. And I'm doing the natural route too. I think it's completely starving this cancer. But the reason to do chemo and radiation and surgery is to get it completely out of your body so you don't need to worry about it coming back. that's how I'm viewing this. And if I were just treating this with diet and maybe some natural supplements, it would be about maintenance and not allowing it to metastasize, or, you know, maybe we could starve it so that it doesn't continue to metastasize, I should say, because it already had, or grow, maybe even shrink it. But with a lot of those natural therapies, if you stop that therapy, it comes back right away. And so the goal of going through the chemo and the radiation as well is long-term quality of life. So I get to the other side, and then I don't need to stress about it, don't need to worry about it anymore. Also, the genetic test, I'm not sure I did a video update on that. The genetic test came back negative. I do not have any of the cancer genes. I have one spontaneous anomaly, they called it, that showed up on the genetic testing, and it is not known to be associated with cancer of any kind. And they said, actually, usually they don't associate with that. It is, the immunologist told me it was associated with autoimmune issues, which is interesting. But it was a spontaneous mutation that happened in me. It's not something that is genetic that I can or have passed on to my kids. And so that is also very positive news. So that's my update for today. I wanted to add, the doctor did actually give me a statistic about women who do not do radiation versus do radiation for this triple negative breast cancer. I believe it was specific to triple negative because it is such an aggressive form of cancer. So we're doing the chemo, the surgery, and the radiation with the goal of completely curing my body of triple negative breast cancer. If you don't do all of those steps, there is a percentage of recurrence, and I believe she said it was 25% recurrence without radiation. And if you do radiation, it goes down to 1% recurrence. And so, and also she said there was, I don't think she gave me the number of years, but longer lifespan in general. So not a metastases in a different area of the body, which breast cancer can do as well. It can jump somewhere else. So she said, so that's the reason why I am agreeing to this targeted, finishing the chemotherapy, doing the surgery, and then doing radiation as well. It will be traditional radiation, not accelerated. That's because of my age and because of the fact that it's triple negative breast cancer, but that is going from a 25% chance of a recurrence to a 1% chance of a recurrence. So I wanted to add that in to my video.